Thank you for joining Let's Meet Where We Eat, conversations with innovation and entrepreneurship leaders who specialize in food and nutrition. Our series is presented by Nourish Cafe and the Food and Nutrition Innovation Institute at the Tufts Friedman School for Nutrition Science and Policy. Enjoy. So I run the Tufts University Food and Nutrition Innovation Institute. You can check out our website, and Hallie can drop it in the chat to let you know what we are, but we're essentially the largest food innovation leadership council in the world, from soil to cell. Latham Thomas and Mama Glow was one of our member organizations on this Innovation Council. So we're not just about food companies, but we're about all of the people in the food supply chain around health, getting healthy, what do we eat, nutrition, how we care for each other. It's the whole thing. So we're also glad that you're here today. We made a decision this year to offer Lunch and Learns. This Lunch and Learn series is an hour and a half featuring one of our members, and where we basically, as Tufts University, hand over the mic. I said to myself, Tufts has a big microphone. What do we do with it? And the answer is you hand it to people. And so I'm so excited today to be able to amplify and hand the mic over to Latham Thomas. Latham and I met about 5 years ago, and like she just lights me up every single time I see her. And we've always dreamed about doing something together, and finally this came together. So Latham, thank you for saying yes. Thank you for all the incredible work you do in this world. You're going to get to meet her, the CEO and founder of Mama Glow, hear all about her stuff. Then we're going to have some great fire talks happening, speakers from Tufts University, other partners, actually partners also on our Innovation Council, and then entertain questions, comments, thoughts from all of you. So thank you, all of you, for being here. We are recording it, so it'll be available later. And with that, Latham Thomas, the woman herself, you are amazing. I'm going to turn it over to you.
Much again, and I'd also like to acknowledge Haley, who is here and who is helping with all of our back end work and made sure that you all could join us and handle RCPs, as well as Leona, who is not here, who's on the Mama Glow side, who worked closely with Tufts to help put this together. So thank you all so much. As we sort of ground in here, wanted to take a moment to also think through like why we come together in this way. And, as the founder of Mama Glow, which is a global maternal health and education platform that's committed to advancing birth equity through various channels, but primarily through doula education and workforce development and doula matching services. One of the things that's really important to us is how do we keep families well and make sure that they thrive? And a key, part of that is like how we take care of ourselves through the things that we eat and what we put in our bodies. And we know that a lot of us are living in food deserts. A lot of us live in areas where there's less access. And all of us who are here, whether you're working with families, whether you're a doula or healthcare provider, whether you're someone who's on the research side, we can all come together and share not only the learnings and the practices that we've implemented over time, but we can also think through solutions that allow us to come together, cross collaborate, and also not work in silos. And what's so important about today is that we're bringing together people from various areas of industry for the purpose of having those conversations that should be happening in one place rather than so spread out, right? And so we're excited to have this very first opportunity, hopefully one of many, where we can have these conversations. We also want to lift up and celebrate the people who are not necessarily speaking today, but who also have contributed so much of their work and expertise to the field and have made commitments to helping advance maternal health and women's health writ large. And so those of you who are here, everybody's been dropping in who they are, where they're tapping in from. We're so grateful for you and your work. It's so critical. You are needed. And we're really glad you're here because another hope of ours here is to build community, right? And so we see this as an opportunity for us to come together, bridge gaps, but then also think through solutions and support each other along the way. Say yes. And I can't hear you because all I'm on mute, but you can throw up an emoji or drop in the chat. Okay, awesome. So as we get started, I wanted to take an opportunity to really kind of spotlight what we're thinking about at Mama Glow. And one of the themes that's really important to us right now as we think about solutions. And I'll be speaking a little bit today about feeding the future, designing care ecosystems for thriving mothers and babies and families. And so for all of us who are, doing work in this space. Our work is really rooted in birth justice, community-centered design, and reimagining maternal health from a pillar of care that's more holistic, and that also is grounded in the reproductive justice framework. And so here we want to call on healthcare systems, we want to call on our brand partners and communities to kind of co-create ecosystems that work for us and that also honor culture, promote equity, and center joy. Because as we do this work, y'all, we got to be happy, we got to be having fun. Okay. And so feed the future as we see it is not just about food that we eat, but also like how we nourish ourselves through community, through relationship to community, relationship to land, right? How we show up in the world around us and we think about the environment, which is really our first home. And then also when we think about before someone is born, the womb is the first environment, right? And so we'll kind of be thinking like what it means to feed a mother, not just with food, but with rest, care, respect, and connection, right? These are all really important aspects of nutrition that also help us to assimilate the foods that we eat, but also help us to thrive in the world that we live in. And so we think about this ecosystem of maternal care, where food, birth, and sort of healing intersect. For us, we think about nutrition not just as a health issue, but a justice issue. And I want to frame that up today as well. And so, and the impact of like cultural and ancestral foodways in pregnancy and postpartum is also something that I want to talk about because these are things for me that have been really important as I've worked with individuals and families, but certainly as I took my own journey through pregnancy and connecting with the cultural foodstuffs that kept me well and also connected me to a lineage of culture. A couple other things we'll be talking about are some of the fragmented pieces of care and how we can maybe build something differently, a little bit
So he's going
stronger.
to have to battle it out in the court in front of a jury and hope that a trial can exonerate him. But
Is there a
as of
mute?
right now, she seems confident that she's going to take this all the way to the end. She's fought against a number of investigations into her claims. She's
Holly, can you mute? Thank you. Okay, great. And so, and then the power of design is another piece, right? What a thriving maternal health ecosystem will look like when we come together like we are today. And the final pieces are really around how the wellness industry, academia, and corporations can show up differently. And that's where we'll be seeing a lot of in practice in our lightning talks, right, with our partners here and folks from industry today and academia. And so I think that the first piece of this is really like what it means to like feed a mother, what it means to feed a family. And it's an honor to be here with you all today. I want to take the time to really think through, and you can drop in the chat as things come up for you, what it truly means to be fed, right? When we think about nourishment, I want people to drop in the chat what it means to be fed, what it means to be nourished, right? A lot of things come up, but like if you can drop in the chat one word or one thought or one reflection that comes up for you, we'd love to see those come up in the chat. Um, to be loved, held, respect, care, comforted, whole, care, open, cared for, nurtured. Yeah, a lot of us are sharing similar things, right? Which really come down to filled, supported, right? Which come down to how we are made to feel, right? And and so when we think about feeding people, it's not just with calories, it's not just with supplementation, but with care, respect, and connection, as folks are sharing here. Feeding a mother means like building a world around her or around a birthing person that says that you're not alone, that you're safe, and that you're held, and that we're going to find solutions, right, and work together to create supports, right? And as we think about this at Mama Glow, we think about the birth village, right? And I see nutrition as a big pillar of that, but also bridged with other supports, right? It's one thing to talk to someone and say like, hey, like, what are you eating, and ask questions about what's happening in someone's life, and think about like diet, but then not confront lifestyle, or not confront like, structural challenges that might make it hard for somebody to access the food that we think that it should be eating or that they might want to eat, right? And so this kind of helps us bridge these conversations and think through what it means to really support. But making sure people don't feel like they're alone, right? Creating that ecosystem is really important. And so, as we talk about that, where food, birth, and healing intersect, maternal health care is about an ecosystem, not a checklist, right? So, this is about creating pathways of support that include food, obviously, like deep nourishment, sleep, ceremony, support, all of these things are connected. Thinking about like how this works within the birth village, when we have nutrition, we think about dietitians only, right? And then we think about birth being, all the way over here with like the OB team, right? Or the midwifery team and the doulas over here. And then we think about mental health all the way over here with therapists, right? Like, how come we're not all talking? Right. And so thinking about how this comes together, this fragmentation actually causes harm, right? When we can't have conversations with people and also work as a provider network and team that's supporting individuals and families, we actually see people fall through the gaps and fall through the cracks, right? And so, really, the opportunity we have here is to design differently, where we develop care connection. There's many tools that can be implemented, obviously, to create less fragmentation. But I think one of the biggest things that we can do here as providers and folks who are in community is ensure that we have access, right? That you have within your network, connections to therapists, connections to nutritionists, connections to, right, other care providers, people who could help build out that birth village for the individual to ensure that they feel that safety and that connection, um, and support. And when everything works together, it's really brilliant, right? When we have providers who, cross collaborate, it works really well. And so, we think about nutrition. I want to jump to this idea of, justice, right? And food justice. In my work way back in the day, when my son's 21, when I was like in my late 20s, I was working in the city in New York, and where I still live. And at the time, I worked with teens, and we did a program that was an after school program, and it was a program that was rooted in food justice and food security. And so the students who came to this program were from all over New York, but they were also teenagers who were not in charge of the food in their homes. And so when we would make these meals together, they would be like, "This is amazing, but I can't like get tempeh in the South Bronx, right? Or this is amazing, but like my mom is not going to buy this for me, right?" And what we realized really quickly was that, like, while it was really great that we were teaching these kids in this 18-month course, like how to be food advocates and food justice advocates, and like, help to raise awareness, but also to bring better food stuffs to their communities, we also realized that like there was a limit to what we could do if we weren't also bringing their parents, also bringing in grandparents, also looking at what the safety net looked like around them in social services to understand what benefits they'd have access to. Like, could their parents access something through WIC or through SNAP, or like what could it look like, right? And so that's where really listening, right, to what's happening in the community and what's buzzing in the beehive, and also where there's like a little bit of a disconnect because we think we're doing so well, and then we find out that like this is limited to this classroom, right? And so what does it look like to think like, how can we design more broadly, but then also bring in the work intergenerationally? And so that's one of the invitations as well, right? To think about what does it look like to bring elders to the table who have amazing recipes and cultural foodstuffs that have been working for forever. And let me tell you something, all the stuff my grandmother had us eating, y'all, is popular now, right? Like the things that I was like, I don't know why I got to eat cod liver oil, and I don't know why I have to have this, and why are you making me have castor oil, and why do I have to have black shot molasses, and why do I have to eat kale, right? It's popular now. And so we see how like all of these things that like were ancestral and were sort of like embedded in part of our culture also come to the surface and get studied. And then there's actual scientific proof that what your grandmother and what your mother said was right. Right. And so honoring that was really important. So for us, it was like bringing those individuals in, right, and gleaning not only information from them, but guidance, and then shaping the program that way. And so that's how you can bring community-centered design into program development, but also to inform the choices and solutions, right, that you're building for community, because they have to also be part of community, right? And so thinking through, who has access to organic produce and what does that look like, right? We really take for granted that we can go to a grocery store. I can walk to my grocery store and it takes me 3 minutes, right? And there's two. I'm moving to an area where maybe I don't have that same access, right? What does that look like, right? When you're navigating and you have the young children, or you have you live in an area where you have less access because of transit, right? And you have transit issues to like even get to the foods that you're trying to reach, right? So who lives actually near a grocery store? We also take for granted that there were, smaller local stores everywhere, and that's kind of like been replaced by like Walmarts, right, in many places, or stores like that that also carry produce. And so we don't have like our local produce people, but we also might not even have farmers markets or CSAs and things like that that could also help supplement for those of us who would like to do that. And also those are places where you can get these foods and work with farmers who might also take benefits, right? And so this is really important also to think through like who gets time to cook, right? Like what does it look like to actually prepare your food? And preparing food takes time, right? And so many people, if they think through like some of the best things that we eat, y'all, take time to cook, right? Like our favorite soups or stews or whatever it is we're preparing, a lot of times it's not just like a 5-minute meal, right? And so what does it mean to like have the time, like where did that time come from to prepare the food, right? And in a time where we're living through where people are really struggling financially, like what does it mean to like even be able to afford some of the ingredients that are like critical, right, to your cultural sort of foodways, right? That's also important. And outside of just taking the time to cook, but even to be able to rest and digest, right? Which is down regulation, which is a opportunity to sit in community, be at a table with your family. Most of us aren't able to do that. Like we're working, like our kids are eating the food that's like sitting and gonna be heated up. And then it's like all of this revolving around productivity. And then when we get home, we're still trying to be productive. Even when we eat, we like have a way to like, make sure that how we are eating is also optimized, right? And so thinking about nutrition also as this form of an act of resistance a little bit, like moving away from just like this idea of food as fuel, but like this experience of eating as empowering, because it's a time where we get to connect with our family members, ask questions, and learn about what's happening in our lives, right? Food has always served as that gateway, right, for building community. And so thinking about, things like, race, class, zip code, and how nutrition is impacted by structural racism, by housing, by our ability to stay home after having a baby, and most of us don't have paid leave. Thinking about land access, environmental toxins, right? These are things that all impact the access that we have to food, how we're able to prepare it, what we actually assimilate in terms of nutrients, right? And then, what ends up becoming of us, right? I always say that, food becomes like our blood, our thoughts, and our actions. Right. And so whoever has access to the best food, right, gets to like build their bodies in a certain way, gets to like show up in the world in a certain way, gets to have energy. I think about young people that I taught back in the day and how some of them were teen moms. And I remember how tired they were all the time. And then we started asking questions and I realized, oh, they haven't eaten. And so we started bringing, snacks in, and I'm like, what is happening? So talking to the school administrators and all this stuff to figure out like why these girls are so hungry. And then kind of find out everybody's pregnant. And so I'm like, we got to feed these people, right? And so making sure that there was just like snacks, like in all the classrooms. And then teachers also were like, we can put some money in, and just like make sure that there's stuff they can eat. And so we were thinking like, what's like high nutrient, like what's nutrient dense that we can just like have everywhere. And so we decided on a couple of things. We had fruits always. We had like little bars that were like protein bars and things like that. And that was helpful, but like nothing really substitutes like having an actual like meal to start your day. Like breakfast is really important. And so we're thinking like that, like these students weren't even getting that, right? And so important to think through, like what that means, right? Like being able to like eat and have, like food really is like political, right? And nourishment is actually really power. And so to kind of bridge from here, and I want to kind of, be able to move us to the talks that we're going to have. I want to talk a little bit about, some of the benefits that we have to embracing some of the cultural and ancestral food ways when we think about nutrition and pregnancy and postpartum. One of the things that we do a lot here at Mama Glow when we're talking about culture is thinking about like how people can embrace some of the traditions that come, from where they are from to bring in some of the healing and more restorative and recovery, right? Supports that are necessary after having a baby, right? In pregnancy, obviously, nutrition is critically important, but in the postpartum period, people don't think about a lot, like what happens. After a baby is born and what that does to your body and what's necessary to actually to replenish. And so part of that replenishment happens because we're eating, right? And for those who are actually also nursing, then you have the added work, right, of creating now like food to nourish a baby. And so you still even need even more food to make sure that you're nourished. And so thinking through what it means to embrace what's cultural. And I would love for people to drop in the chat, like things that like they know are foods that are healing and nourishing when they're going through some, it could even be birth or postpartum. If you think about like, if you have had children, share in the chat, like what are some things that you might have embraced, or maybe things that you've done with clients, or maybe suggest to people that you work with. Even if you've had an injury that you've sustained and you're trying to heal from it, what were the foods that you turned to? I think the thing to really understand, right, is that we have different types of foods that we lean into for different periods of time, right? We have like sort of our maintenance diet, and then we have maybe a therapeutic diet, right? When we're coming on the other side of a big event like birth, right? And so what do those foods look like? And you notice how sometimes like when someone has a baby, here comes family members like, okay, like you have to have the famous soup or the whatever it is, right? To get through. And here comes grandma pushing everyone out the kitchen to make this dish, right? And so we know, but there's a reason for that, right? Because there's something not only like in that recipe, but in even that preparation, right? In the ritual of preparing that food, bringing that into ushering someone through culture into this new time in their life, right? And loving them through that process, right? Which is also part of what we're talking about here. It's so necessary, right? In this transition period. I love to see the things that are popping up in the chat: bone broth, soup, stewed fruits for our postpartum clients, elk stew, mushrooms in curries and soup, to soothe and strengthen the immune system and digestive tract, Haitian legume vegetable stew, soups with herbs, um, and for anemia, yogurt. Yes, look at all the different things that we all lean on, right? And so important also to acknowledge that these are not alternative, right? These are ancestral. And I think it's really important to like reframe so that we're not like siloing foods, but really centering them and saying, what are the foods that are important to you culturally? And a question that I always like to ask people, right? It's like, let's talk about some of the foods that are important to you, right? Instead of saying you should be eating or you should be getting, because most people can't understand what it means to have like vitamin A or B, like they don't understand, right? But if we can say to them, like, here's some foods that would be really helpful in building up your blood, right? Postpartum, right? Here's some foods that could be really helpful in like, helping you increase immune function, right? Here's some really great, you know, uh, breast milk building foods, right? Like those are the things that people understand, right? And so thinking through how we can fold these foods in and even ingredients and help people find ways to integrate, right? That's really important too, but also asking the questions, right? And so when we're thinking about these foods, I think what's important as we integrate is that we tell ourselves that you belong here, that your ways are valid, and your body remembers, right? Whenever we go to a place, like there's certain foods that I eat that I just get transported, right? Or certain smells when I go in the kitchen, I'm like, yes, and you get transported. That's the power of food, right? That it can also transport us, but it also can be a powerful pathway for healing. And this can be one of many things that we use to support ourselves. Also, supplementation is a great idea as well. Um, and so the last piece I want to kind of like, lean into as I talk about this and also shore up the support that's here in the room today. There's obviously been a lot of fragmented care delivery in our current system. And there is a possibility for us to do things different, right? When people leave the place of birth and they have a stack of paperwork and no roadmap for healing and don't talk to their doctor for 6 weeks, and then they're not sleeping, they don't have support when they get home, who's feeding them, right? What does it look like to nurture and build care systems that don't require a crisis, right? But actually are built with compassion first, right? Built with the anticipation of the needs of these people first. And so that's something that we can be thinking about as care providers, as researchers, as doulas, as people who are in this space, developing solutions and also delivering that type of care, right? And so when we think about this, it grounds us in what a thriving maternal ecosystem really looks like. How do we design that? What would it look like to design a maternal care system, ecosystem that truly nourishes? And I want us to drop in the chat. What would that look like? What would it look like to nourish people? Right? Like I just get warm thinking about nourishment, not just food, but like spiritual nourishment, emotional nourishment, the nourishment of community that community brings us, right? That joy. I think that yes, collaborating with farmers and herbalists. Yes. What else? What else would be truly powerful as we design something new and different? What else? What would it look like to have meals rooted in culture and delivered to the home postpartum? First of all, I want this, right? I want people to be thinking about me because postpartum is forever, okay? My baby's 21, but postpartum is forever. Come bring me some food, right? How come nobody's asking me if I want some food? Also, the people who provide care, they need meals too, right? So doulas, care providers, nurses, doctors, physicians who are here in any capacity, people who PCPs, whoever, whatever you're doing, you need to be fed too. Think about the rotation, the hours, people on 12-hour shifts and not eating, and what that looks like, and what kind of care you deliver when you have not eaten. Right. So we need to all take care of ourselves like we should be taking care of our patients. Someone said flexibility, creating co-op care, meal trains for postpartum, meal home delivery, giving positive affirmations, providing them with the tools and resources so they can understand how food impacts a body. As you were discussing earlier, don't just eat this because it's healthy, but there's an actual, what does it actually do to you from a physiological aspect? And more one-on-one education and more home cooked meals and postpartum meal delivery. Yes, all of this is so great, right? Like this would really help people, I think, to thrive. Community care teams as well, right? So looking at doulas, lactation support, herbalists, aunties. I say the aunties, bring the aunties and the grandmothers back. They're not busy. They're waiting to be called on. Bring them in. Right, bring them in. These are people who have a lot of tools to help us and to guide us. And these are people who they're always right. Right, they're always right. They're always right. Like you'll read a research, some research that's been like editorialized, and they'll be saying essentially that your grandmother was right. And all of this to say that this is knowledge that like leaves, right? And sometimes we don't capture it while they're here. So bringing these people back in, finding ways to integrate their knowledge base, but also the tools and the skills and the foods that carried us through by generations. And so The other pieces are like soft places to rest, recover, and also time to bond, breastfeed, and be, access to green space and nature, movement, being able to be in community, right? Like these are all things that we could actually develop, that we can think through differently. So we have to show up differently to do this work. We can't just be selling people products and like, detox teas and we really need to think about like access and safety. We need to be thinking about this not as a trend, but as an actual long term commitment and goal to improve maternal health care. We also need to ensure that money is funding this work to advance access research, but also community centered design to improve food access and also center food justice, right? And then also think about, less thought leadership and more resource redistribution, right? Like meaning that like more folks who need information are getting it, but also that we can get people more access to the tools as well as ensuring that people are well fed, right? And so, as we do this work, I just want to invite everybody to think through how we do it joyfully, how we draw on a community to do this work. I want us to continue to model how we do it by making it beautiful. Like when you're collaborating with partners, like share a meal to do that, right? When you're thinking about how to come together, I mean, some of y'all are eating right now, which is great because it's lunchtime, right? And so that's apropos of what we're talking about today. But really just think about like this is how we evolved, right? These moments nourish us on a cellular level, and they remind us that like really like love is a form of medicine, that nutrition is, food is medicine, and it's a pathway for us to be well. And so this is a call for us to really be intentional as we think about feeding the future, to design maternal ecosystems that do more than respond to crisis, right? But that are also sensitive and are expansive. It's a call to center culture, care, and community. The aunties, remember the aunties, right? And also to weave joy into this fabric, right? As we talk about birth. When I think about food, y'all, and I think about family, I think about a pot of gumbo on the stove and my grandmother humming and a whole bunch of kids in the background screaming. And I think about like, us all, pulling up a chair and hanging out in the kitchen where there's other spaces to be, but we all somehow end up in the kitchen. I think about, the foods that she would make for me after school and how she would cut me a slice of pound cake and give me coffee, which I shouldn't have been drinking at the age of 9. But I remember just that, those are the core memories, right? And that really shaped who I am, but it also helped me to understand like who I was through the lens of food. And so I believe that this is our pathway to think through what nourishment looks like, as we nourish ourselves, our mothers, with respect, with reverence, and obviously with rest as part of that as well. I want to thank y'all for your attention and the time today. I'm so grateful to our Tufts community and family here. I'm really, really excited and grateful for the people who are here to talk to y'all. So get ready. Okay, for the lightning talks, I'm going to hand it over to Hallie, who's going to introduce everyone. Just drop in the chat how you're feeling, any reflections, and stay tuned for the next portion of the program. Thank y'all.
Thank you so much, Latham, for that amazing talk. I think we're all feeling very inspired right now. So without further ado, I'm going to start the lightning talks. We'll hear from 3 amazing women working across different spectra in this area. First is Dr. Jennifer Martin Biggers. She is the Vice President of Product and Innovation at Parallel Health. So Jen, go ahead.
Let me pull up my visual aid here. Okay, I saw Latham do this. That means it's presenting. That's good. So thanks so much for having me here. So my talk is going to be a little more kind of like in the weeds, like with the nutrition science and research, but something that at Parallel Health in particular and across the dietary supplement space is something that I think helps our company to stand out and is something that's definitely more needed. parallel, we very much believe in this concept of stage-specific nutrition. We don't see life stages of women as a one-size-fits-all, especially during pregnancy. Yet, if you look at the products that are available out there, dietary supplements to provide nutrition support during this important phase, it's generally kind of like, yeah, here's one prenatal, take it at the, when you're trying to conceive, and then continue taking it postnatal for a few months, and that's sort of it. But what we know is that the research doesn't really support that. So while there are a lot of research gaps, there's still a lot of areas where we can make sure that we're helping to tailor nutrition needs for women across these like really kind of 5 stages throughout their pregnancy journey. So starting at the stage of conception, we know obviously nutrition and nutrient status plays a critical role in fertility and in reproductive health outcomes here. It also helps to lay the groundwork for early fetal development. Oftentimes women don't know that they're pregnant, and their nutrient status can have very big impacts on that early fetal development. So nutrients like folate for neural tube development, CoQ10 is a very interesting, powerful antioxidant that helps with supporting cellular energy and egg quality as well. So there's a big opportunity. I was just at a conference 2 weeks ago now, and there was a lot of conversations about the research gaps and areas of opportunity to do more funding and collaboration on how we can really make sure that we're optimizing what nutrient status pre-pregnancy looks like for women. Then moving into the first trimester, we know this is a big foundational window of time when organ development is underway, yet a lot of essential nutrients like folate, choline, and iron often fall short, even if someone is supplementing. There's also the impact of maternal symptoms like nausea that can make tolerability difficult. So taking gentler forms of iron, like a ferrous bisglycinate, it's a chelated form of iron, a little bit more gentle on the GI system, can be very important. There's also interesting research around vitamin B6 for nausea support that can also help make a difference. And again, you kind of see, I keep highlighting where there's these gaps in these different stages still. And here we really need to understand more how nutrient bioavailability and this tolerability aspect works together. When this nausea can be a big deterrent to getting nutrients and healthy foods that a mom needs as well. Second trimester, there's a lot of continued fetal growth accelerating, including blood volume with the mom. There's bone and teeth growth and development. So in particular, nutrients, calcium and magnesium, DHA and iron are highlighted and even more important in this specific trimester. There's also some interesting research and need for understanding how nutrient status at this phase can influence risk of certain pregnancy complications, like gestational hypertension. Into the third trimester, we see fetal brain development really surging and these maternal nutrient stores being under, kind of like the last little bit of pressure here. So nutrients like DHA, choline, iodine are helping to support that continued neurodevelopment and cell growth of the baby. And again, continued needs for calcium and magnesium for skeletal growth, also supporting maternal muscle function. And here, there's a bit of a research gap in understanding how to balance energy intake from calories from food with these increased nutrient needs at the very end of the trimester phases. And then in the postnatal phase, like Latham was saying, we know after birth, it doesn't stop. It continues, not just for like the couple of months afterwards, but much beyond that. So there's a really big need to understand nutrient needs around recovery, lactation, mental health, which is something I very rarely see emphasized. We know that mental health, recovery, lactation are all nutrient dependent, yet there's some areas that are overlooked there. And many women remain depleted in their iron stores, their B vitamin, their choline levels, and more. And this is kind of like areas of nutrients that are very rarely addressed in clinical care or in dietary supplement, prenatal, postnatal product formulations. And again, a lot of needs to understand beyond the research that we've got, what is an optimal kind of supplementation? What are these optimal nutrients that are needed in this postnatal phase and beyond? So there's very clear opportunity to help with advancing research and innovation across all of these stages of pregnancy. Parallel, we're really working to provide products that meet these stage-specific needs and formulas. Again, in like easy to take little sachets, and also partnering with researchers and clinicians conducting clinical research to help define and understand what this optimal maternal nutrition should look like throughout this entire phase before, during, and also after pregnancy. Thank you.
Lovely. Thank you so much, Jennifer. And that really helps us frame sort of what we're looking at from the clinical side and the nutrient side as we talk about this. Next, we're going to hear from Dr. Perry O'Tierney-Jones. She is Executive Director of the Mother Infant Research Institute at Tufts Medical Center. So Perry, find your video so I can spotlight you here.
Thank you so much for inviting me today. I'm Perry O'Tierney-Ginn, the director of the newly renamed Woman, Mother, and Baby Research Institute. We've expanded our mission to include women's health across the lifespan, but still very much focused on the special relationship between mom and baby and how that impacts lifelong health for both of them. So I wanted to start today by bringing up something you might not think of. A baby's adiposity, or their percentage body fat at birth, is actually one of the most sensitive markers of maternal nutrition that we have. Even among healthy pregnancies, it varies between 2 to 20% at the time of birth. So why do we measure adiposity at birth? Beyond mom's nutrition, it tells us a lot about baby's health and their future risk of disease. So babies born with high adiposity at birth have, of course, higher fat mass, adipose tissue, but also potentially lower fat-free mass, or such as skeletal muscle, which has really impacts their lifetime nutrition. They have higher levels of insulin resistance at the time of birth. They have lipid deposits in their arteries. They may even have fatty liver, signs of fatty liver at the time of birth. And of course, all of these things together will impact their risk for diabetes, obesity, and heart disease later in life. In fact, it's been shown that a difference in just 6 to 8% of body fat at birth in babies is associated with a 20% increased risk of being overweight or obese at 5 to 6 years of age. So it's a clinically significant measure. And in our studies, how we measure baby's body fat at birth is using skin fold calipers, like they would in an athlete, you can see in the left, and or air displacement, which is we have a little pea pod. It's actually not that little in our NICU at Tufts Medical Center. So we use both of these methods for measuring baby's body composition. So maternal obesity, what we define as a body mass index of greater than 30 kilograms per meter squared, is, as many people know, associated with fetal growth and is associated with high neonatal adiposity. But as you can see here in data from our group of over 150 pregnancies, there's quite a bit of variation in baby's adiposity between so-called lean and obese maternal groups. And the source of that variation is a main focus of our lab because what it can tell us about maternal nutrition and also her baby's health. And during a doctor's visit, as many of us know, there's a big focus on a pregnant patient's weight. But the maternal metabolic milieu, as I call it, involves all of these factors here in blue. So anywhere between how glucose tolerance, oxidative stress, inflammation, diet is huge, lipid levels. So all of these are really important for pregnancy outcomes. But how do we know what to focus on for improving health? And that was really why we, in our lab, designed the MAMA study, which is short for Maternal Metabolic Markers of Infant Adiposity. And so this study, which is conducted at Tufts Medicine, enrolled 50 women beginning in early pregnancy and involved comprehensive metabolic phenotyping in early and late pregnancy with collection of the placenta and baby's body composition at birth. So what have we learned so far from the MAMA study? Well, we've learned that early pregnancy as we've heard today, is really a critical period for influencing the trajectory of the pregnancy. So this may be related to placental development, which is also a main focus in our lab, which is highly sensitive to the maternal environment during this time. We've also learned that mom's nutrient metabolism, particularly fats and proteins, may be more important than her body mass index to a baby's growth and to pregnancy outcomes. And one of the other key factors that we've learned is stress is emerging as a consistently important factor in fetal growth outcomes. And we're just scratching the surface with this data, and we expect to learn so much more about how the maternal metabolic milieu beyond BMI impacts pregnancy outcomes in the months ahead. So thank you all very, very much.
Finally, the last lightning talk is Amy Bloomquist, Director of Customer Success at Nourished RS. So Amy, over to you when you're ready.
All right. Hi, everybody. Excited to be here. I'm actually going to talk a little bit about an intervention that we do with the maternal population and postpartum population. But just first, NourishRx is a digital food as medicine company. But so we kind of partner that digital health component of healthcare, but actually we deliver food to the doorstep. So we actually partner it with actually getting food in the hands of people that need it. We started doing the maternal health programs as a pilot back in 2021. At that time, there was not a lot of evidence or examples of work happening in our country around nutrition during pregnancy and postpartum. So we were really curious to see what it would do. And so since then, we've launched several additional programs based on some success we've had. So we'll talk about that. Let's see if we can get this to click forward. So just a little bit about us. I mean, we really believe that diet and nutrition are a cornerstone of all aspects of health and well-being. And maternal health is just one type of program we do, but really we are focused on creating a personalized experiential learning environment where people actually can learn to try new foods, learn how to cook new foods, really have all the things that they need to explore eating healthy for whatever that means for them. A little bit about our maternal health programs specifically. They're typically 6 to 7 months in duration. They usually start around the middle of pregnancy, and then they run through about 2 months postpartum. So we can catch both pregnancy timeframe and postpartum timeframe. Part of the reason for that, honestly, is just finances. Usually we are partnering with an insurance company and health plan, and they're paying for the program and the food for their members. And so we try to kind of match us up so we can get the most benefit out of the program for them. We usually feed the entire household in these programs and not just mama, because we know that if we're only sending food for her, she's going to give it to her other kiddos if they're around, and she's not going to get the benefit. So she might get some specifically medically tailored meals for herself, but the groceries, the meal kits, all of that, we send enough quantity to fit their entire household size. So they get food delivered to the door a couple times a month. They also get regular one-on-one coaching sessions with our dietitians. They also get some wraparound support with our wellness associates. So we do a lot of work to get people connected to local resources. If they're not already enrolled in SNAP or WIC and they qualify, we work to help get them enrolled there. And other types of programs and things that maybe their health plan has that they don't know about, we try to get them connected. So we're trying to tackle really more through a very engaging venue, which is food. I mean, people really get excited about the idea of free food delivered to their door, so we can kind of get them connected in and build trust. And then we use that relationship to really try to do a more holistic kind of wraparound support with a lot of other things. And then there's self-directed online support that they can access at any time, information, recipes, all kinds of stuff. But at the end of the day, what their coaching sessions are based on are truly personalized, based on their unique barriers to eating healthy, and kind of what they're trying to focus on and whatever particular conditions and other things they have going on in their life besides just being pregnant, which is, that's not enough sometimes. They have others. Just a little bit about how it works, the pathway for the member. Like, we really try to connect in and like I said, figuring out what their unique challenges are and help them realize through food and giving them the food at home, so that they can, through experiential learning, kind of have that aha moment, like, wait a second, I actually cooked that. It tastes good. I like it. My kids ate it. right? Like that fear of like going to a store and buying something expensive they've never tried before, they don't know how to cook. We kind of take that off the table. We do work with moms that don't have stoves or ovens, and we work with moms that are homeless. We work with moms that live in the really extreme rural areas and they don't have grocery stores, or they live in an urban area but their grocery stores at Walgreens. So we see and work with all different kinds of barriers and environments around just kind of what the food environment is. Also, we tackle things like nutrition literacy, cooking skills. There's entire generations of people now today have grown up in a household where they didn't see their parents cook. So they don't know how to cook, or they aren't sure what to do. It's really daunting. So we meet every person where they are. Everyone's coaching sessions are unique to them. They are not like a series of, we talk about this in the first visit, we talk about this in the second visit. We take time to get to know the person up front and then work with them on what they need. But through that, we help them adopt these healthy lifestyle behaviors and tools and just the tricks and tips that they need. So when the food stops coming, they feel like they really are set up to continue these the healthy behaviors around healthy eating for their family into the future. Just a little bit about where the food comes from. Each market that we're in, as we have a new customer, we build a local food partnership network. We try really hard to source food locally, like reinvesting back into local economies. So we're getting fresh produce that's local, it's seasonal. And then we supplement with some national vendors where we may not have local partners in that area. So at any given time, we are working with several different food partners to get food to the door, but it could be a meal that's all done and it needs to be warmed up. It could be a meal kit, kind of like a Blue Apron, where you get everything you need to make a meal, or it could be groceries delivered of all different kinds. So it really depends on the stage of the program and also what the mother wants. Some of our programs will very customized to mom so she can pivot as her pregnancy changes and how she feels about cooking. And just a little bit about the outcomes. We track oodles of things, but we look at mom's health, we look at baby's health, we look at more holistic well-being. We also look at food and nutrition security. And then I'm just going to leave you with this. I know we don't have time, but we have lots of member stories, and Sheena is one of our members. At the QR code, you can get her video that she's done with us. Just learn a little bit more about her and her experience through the program as she navigated her pregnancy with us. I think that's the last slide I have, but thank you so much for the time today.
At this point, we are going to move back into a short panel discussion, and I believe Latham is going to moderate that for us. So Latham, are you still there? I'm not sure where she went. Okay. Well, I have the discussion questions, so we can just go right ahead with the panel. Let's see here. So I'm going to pin our panelists, and then I will let them introduce themselves. There's one page. One moment, everyone. At a spotlight. Sonia, where are you? You are.
Yeah, you've got to find everybody in the Zoom room.
Yep.
There's Sonia, you got her.
There we go. Okay, so that'll do it. So hi everyone. I'll just ask our first framing question, and then we'll pass it to each of you to answer. And if you could provide just a short intro, that would be wonderful as well. So the question is, when you think about maternal health, what does nourishment look like in the context of your work? And Renee, you're first on my left, so you can kick us off.
And I would say Latham
Sure.
did come back on, Hallie, if you want to also pin Latham into the conversation too.
Sure. Well,
Hallie, you did awesome pitching in. Thank you.
Thank you so much. Sorry for that. I just had to run to the restroom. And then of course I went when you guys started, so.
No problem. Shall I go ahead? Thank you so much, Latham, for the invitation, and Katie and Hallie for organizing this great panel. I've already learned so much. Amy, I'm going to be connecting with you soon. My name is Ronit Rydberg. I'm a member of the research faculty at the Food is Medicine Institute at Tufts. And so So I'll answer the question a little bit. I'll give you more about my background. Nourishment in my work is very tied to this focus on nutritious food as part of a healthy and strong perinatal experience. If you're new to food as medicine, to expand a little bit on Amy's description, we talk about food as medicine as a set of food-based nutrition programs and interventions that are integrated into the healthcare system to advance specific health needs and health equity in different populations. So in this discussion, we're really talking about pregnancy and postpartum. The FIMI is a cross-university collaboration at Tufts, and it sits at the School of Nutrition, Science, and Policy. And we bring together experts from across disciplines with other local and national collaborators to advance food as medicine research primarily, but also training, patient care, and community and policy engagement. And I'll share just a couple more examples to build on Amy's presentation of food as medicine to support maternal health. So I've participated in programs in California that provided monthly vouchers for fruits and vegetables to WIC clients, but on top of WIC benefits to augment services. I'm also working with colleagues in Boston who provide medically tailored meals to pregnant clients. So 2 examples that Amy's work at NourishedRx incorporates. There are many other examples of food as medicine within maternal health. And in this research, we're wanting to better understand outcomes, clinical outcomes in pregnancy and postpartum. So it might be rates of gestational diabetes or preterm birth, but we're also really interested in mental health outcomes, self-reported outcomes that might be affected both by having high quality, healthy food, but also the alleviation of financial constraints or other positive effects of having additional food supplied during this really critical period of life. I'm also a mom, so this conversation is always at the forefront of my work and my thinking about my own experience and relating to others from many different backgrounds. I will pause there, but look forward to further questions and discussion.
Excellent. Sonia, would you like to go next?
Yeah, sure. Thank you. And, good afternoon. I'm super happy to be here. My name is Sonia Hartunian-Soa, and I'm the lead of nutrition science and advocacy at DSM Firmenich. So I represent the industry side. DSM is the leading global supplier of nutrients such as all 13 vitamins. We sell carotenoids. We're the leading supplier of omega-3 fatty acid, DHA, and EPA, and much more. So you may know us from all of that. And I think many of you are very aware. We supply in infant nutrition, we supply to maternal health, we supply to food and beverages, dietary supplements, medical nutrition, pharma, and much more. So we're really vested in public health. We have merged with Firmenich, which is one of the largest flavor companies in the world, which allows us to bring more solutions to life and health benefit solutions that actually taste good, so people might want to eat them. Now, that sounds funny, but these solutions, if they don't taste good or they're not affordable or accessible, then people do not consume them. So we feel that we're a real powerhouse. So the idea, I was like super excited about this, the idea of nourishment, because in my field, nourishment is truly about micronutrients, such as the vitamins and minerals, and macronutrients, and making sure that you have the lipids, the carbohydrates, the proteins at the appropriate amount. So I spend an exorbitant amount of time with multiple companies, making sure that that balance is appropriate for their brand, for the consumer, for the public health, etc. And I wanted to share one story, which is like the hottest ticket in town right now for maternal health, which is omega-3 fatty acids to help reduce preterm birth. So this is some research that's come forward. And as we know, we need more nutrients during pregnancy. So there's some that go up, some that stay stable, and some, just right in what you need. But omega-3 fatty acids, now there's new recommendations showing that high levels can help to reduce the risk of preterm birth significantly. In fact, there was a Cochrane review in 2018 that showed that it can help to reduce preterm birth, which is having a baby before 37 weeks, by 11%, and early preterm birth, which is having a baby before 34 weeks, by 42%. So that, I'll just pause for a moment, because that is huge, to be able to take one nutrient and have that health outcome toward the baby, and then obviously to help the mom. Now, I also am going to bring another partner in. The March of Dimes gives the United States a D+ for preterm birth. We had an all-time high at 11% for all population. I don't know if you're aware of that, but there's a good chance you know somebody who's been born preterm, or your own children, or maybe yourself. And it's unfortunately, but there's a stark contrast in racial and ethnic disparity where the Black American population is up to 14% preterm birth in the United States. So this is a story that is very compelling and that really needs to be told to all populations so that women know it. Since that Cochrane review was published, there's been an expert panel and new clinical guidelines showing that all women should come into pregnancy now with 250 milligrams of EPA DHA, leaning on DHA. During pregnancy, all women should be having 350 to 450 milligrams of omega-3 fatty acids. And if you're not consuming 2 servings of fatty fish, or you don't have omega-3 fatty acids in your diet in any other way, they recommend dietary supplements of 600 milligrams to 1,000 milligrams. Now, again, those are really high levels, but this is where it's showing the strength of evidence and helping to reduce that risk. So would love to share more about it because there's another side to the story, but I think I'll pass it to our last panelist. So.
Awesome. Esmeret, please go as well.
Yes, hi everyone. My name is Esmer Berhilumax. I am the founder and CEO of a nonprofit called One Love Community Fridge. I'm so excited to be here. I've learned so much already, and I feel like this was like the best lunch hour ever, feeding mind, body, and soul. So we'd love to have more of this. Our mission is to engage, empower, and connect the community, and we do it through education and providing access to fresh and healthy food, leading with respect, dignity, and health. And our main tool that we use are community fridges. If there's somebody in here that haven't heard about the community fridges, they're basically fridges that many of us have at home that we put in public spaces for anyone to take food from or put food in. And so we work with, and we've developed 4 ecosystems around this where we work with food partners to help redirect their food and minimize food waste. But we also work with farms to provide consistent donations and also help them minimize their food waste, but also education opportunities. And we work with schools, and we also work with a lot of chefs. And the schools is really to bring consistency for a lot of our families and providing resources outside of schools. And then with the chefs is, again, bringing consistency into what we bring to the fridges. But all in all, at the end of the day, it's more than just bringing meals. We really think about nourishment in terms of community building and how do we address hunger, food insecurity, malnutrition through community building. Because as we mentioned, all of us has mentioned, like, food is medicine, food is information, and food is power. And we, fundamentally believe that food is the foundation for our health. And I was gonna say, I don't know. I actually forgot myself. You know what it is? Please forgive me, because I think I've been listening to everyone here previously, so there's so many thoughts in my head, and I think so I'm a little bit, I got sidetracked a little bit, because what I keep thinking is, and what kind of carries us in our work with One Love has been, we are a nonprofit, but we really see ourselves sitting on this intersection between nonprofit and for-profit and public and private companies, and try to really think about, like, where can we have the most impact? Where do we ensure that everything that we take on, initiate, has longevity and is sustainable, so that we are building an organization that includes and invites as so many people as possible to participate in works in the ways that work for them. So that's like one of the things, like, I was thinking about as we were talking. Because for us, at the end of the day, is, everybody needs food. Food is powerful, as we mentioned. Food has the power to bring people together, but it's also used to divide a lot of people. And for us, it's like, okay, how do we again create these rooms and spaces and opportunities for people to be the best they can be through food? And that, for us, that means collaboration. It means community-led solutions. And it means removing stigma that's attached to hunger and food insecurity.
Yeah, thank you. Thank you for that answer and for all of your insights. I'd like to come back to Dr. Ronit. your work explores the intersection of technology, medically tailored nutrition. I'd love to explore what role you think that tech-enabled tools like produce prescription platforms can play in transforming access as well as outcomes for pregnant folks.
Yeah, fantastic. So one of the reasons I love working in food as medicine is that the field has been changing so quickly. When I started the projects I mentioned in California, those were all paper vouchers. And so now a study that I'm co-leading with colleagues in Houston, which is about to start enrolling 400, recruiting and enrolling 400 women with high-risk pregnancies and Medicaid insurance. We have a prepaid debit card that women can take to the grocery store over. This program is actually based in Boston. It's called About Fresh, Fresh Connects program. And retailers all across the country accept this card for fruits and vegetables. The participants will receive $100 a month. It is automatically reloaded on their card at the first of every month. And from enrollment, let's say up to 20 weeks in their pregnancy, so through the first trimester enrollment, second trimester, third trimester, and through 2 months postpartum, they'll receive $100 a month to spend at the grocery store. Many studies in maternal health stop at postpartum, and this is something I'm very interested in pursuing further. So just remember that for our next question. Most studies in produce prescriptions have shown that people don't use all the benefits on their card. So even though this is a great platform, it's also not being optimized entirely, right? And one of the things we're curious about is how to, if it's possible, and how to encourage more benefits utilization. So in this study in Texas that I mentioned, we'll be randomizing half, everyone will receive the card, but we'll be randomizing half the group to also receive high touch engagement. They'll get weekly text messages from the food as medicine vendor that will include a variety of messages. Some might be balance reminders. We think that might be one of the biggest barriers to shopping, is not knowing or easily knowing how much money is left on the card at a given time during the month. We will also be sharing recipes, nutrition information, shopping information. And so half the group will be receiving this high touch engagement. And we'll be looking between the groups if shopping patterns are different, if utilization of the benefits is different, and we'll also have the capacity to look at individual text messages and which types of messages might encourage behavior differently. And then ultimately, once we go through and follow these women through their pregnancy and delivery and into postpartum, we'll also be able to look at their outcomes in the two different groups and see if there are any relationships between the enhanced engagement, the high touch messaging and communication and shopping patterns, and then outcomes that we'll be measuring as well. So I think this is a great example of how quickly in just 5 to 7 years the field of produce prescriptions has changed, and how we can utilize technology and digital platforms to really ask very interesting and important questions about how we can best serve clients across the country.
Great, thank you for that. So robust, right? It's like really important also to, I feel like, use all these tools that have become kind of like equitable in terms of access. Like, most people with their smartphones now, and getting that digital information, meeting them where they are with texting, and like validating that as a pathway for learning, I think is really important too, because it's becoming the preferred method of contact for people, and also like they're on their smartphones, and so it's so smart to really like reach them where they are too. And yeah, I remember the days of like paper everything, and and sometimes too, like even with trying to get people to come to something like you're doing a cooking class or whatever, like they're not gonna take that flyer or remember to come. And so this is such a great way to like be in their face, and I look forward to hearing sort of like what findings come of it. Thank you. Sonia, I'd love to ask you, from your personal vantage point, right? Like as someone in industry, if you could kind of like help us understand this landscape of how maternal nutrition is being prioritized or under prioritized, and then sort of what's happening now. We're also in like a completely different landscape when we think about like resources like on the federal level and what it means for states. And so it would be interesting to understand like what does that look like, and what you're seeing in terms of trend, and also like how can we bring all folks together also to increase access in terms of the information that's also being disseminated, because as you know, like you can Google, but like, are you actually getting like information that's accessible? And that's also like, for you. So if you could help us understand like what you see landscape wise, and then also how we can like get better access to the information we need.
Great. So I can definitely speak to that because I speak on maternal health every single day to brands and customers across the nation. So it's definitely right now high focus. In the last administration, maternal health was highly prioritized. So research fundings were going there. And we've seen an increasing trend of wanting to help within women's health in general, whether it be menopause to having babies to even menstruation. So we're seeing an increased interest in women's health and supporting. Now, so I'll kind of describe a little bit about what we're doing, and I think this will give the whole private-public partnership, which is becoming increasingly more important. We cannot rely on one funding in one area, and I think that this is an important topic for access for women to get to. So if you guys remember the folic acid fortification and neural tube campaign, right? So everybody's going to nod their head because now in America, almost every woman understands like, oh yeah, I'm pregnant, I need folic acid. They almost don't even know anymore why they know this. It just is, it's been disseminated since, for many, many years, thanks to the March of Dimes and many, many other players. And also due to the folic acid fortification mandatory bill in 1998, which requires that all of our flowers be fortified with folic acid in the United States. That took a problem that was a double-digit problem in the United States to now neural tube defects are only at the single digit. So that kind of tells you a little bit about there was science, there was an understanding of what we needed. We needed consumer access and we needed to educate consumers, and we also needed policy. So by taking a playbook, the story I shared with about omega-3 toward preterm birth is actually even more outstanding because the numbers of preterm birth are even higher than that were neural tube defects. So how do we do this? DSM Formation advocates on a regular basis for good public health. We're lucky in that standpoint to be an industry and see a wide spectrum and then advocate on behalf of good health. So we have taken expert researchers to the American Society of Nutrition or to the American College of Obstetrics and Gynecology. So you take it to the science community and make sure that they understand. We have taken messages and key individuals to Washington, D.C. The Black Maternal Caucus is understanding this so they can disseminate to their constituents to better understand, to garner support for programs. And right now, these guidelines sit with the ACOG, to try to look at trying to get new guidelines disseminated United States so that the physicians, it's on everybody's mind, and getting access is multifaceted from academics to research to government to private-public partnerships to individuals like the March of Dimes, etc. So I think it's a multi-pronged approach to move policy at this level and to make sure that women really understand what they need during pregnancy.
Yeah, thank you for that answer. So thorough. And I see this multi-pronged approach. And to your point, like, yes, we all know people don't know what folate is, but they know they're supposed to have it, right? So thank you for pointing that out, just giving us tangible examples, right, of like what we've seen and what sort of got embedded in the culture as part of the zeitgeist and becomes part of sort of like our collective knowledge. And we need to get back to that. And so thank you for giving us examples of like how we did it well and like where we can go. I appreciate that. Esmeralda, I'd love to ask you a question about, so you sort of outlined for us how your community-based model of care with the fridges are reshaping food access. Can you speak about how this sort of supports food justice as we talk about maternal health? And if you add, if we think about like policy and industry, what do you think it's important for policymakers to understand about grassroots approaches to food access for families and community?
Yeah, I mean, first of all, like the idea of just like community fridges, and I really hope everyone on here at one point have a chance to either visit or join us or see it, because the whole model in itself is built on trust, so it's very, very different, I think, from kind of traditional approaches to in terms of food pantries and also it actually kind of required kind of like a cultural mind shift to be able to build it. And so even the fridges that we have, it requires this like 3-level partnership and collaboration, which is on the individual level, meaning like neighbors and families. Then it needs food partners, like local businesses, to participate in the process. And then we also need on a macro level, like policy work and also large food owners, because we need the volume. But we need all three, because at the end of it, it is just a fridge that is placed. No, it's a fridge that placed in a public space, and if it wasn't needed or wanted, it could something that somebody could easily just walk away with or damage it. But because it is something that it's placed in the community, and then the ownership is taken on by the community, and then when you have the partnerships on the three levels, it definitely create this level of trust. And then I think the other thing is that it also, because it's available 24/7, it invites a lot more different people to participate. We're also, because there's short the lead times or the process to get food from donors to the fridges is much shorter. We're able to focus on fresh food. We're able to focus on culturally relevant food. We're able to, depending on the time of day they're being stocked, we can also adjust it easily on who is coming to the fridge, meaning like in the afternoon, we see a lot of students. In the mornings, we see a lot of families. We see a lot of mothers. So it just opens up a much more dynamic and personalized approach. At the same time, you're also able to invite so many more people to be a part of this process and contribute as well. And in terms of policy work, I think what is important is, and what this model has shown, is that including community in policy work, in legislation, and the organizations like getting the support for the programming, it's extremely important, because you'll see direct impact, you have tangible impact, and you have a very sustainable model, because you have so many different people participating in the problem. And then a lot of the solutions that are being suggested are coming from within the community and from people that understand what the most immediate needs are.
Thank you for that. And there's so much great stuff happening in the chat. I want us to kind of close and think together. And if people can drop in the chat the answer to the question, what is one bold idea or shift you'd like to see in how we nourish maternal health in the next 5 years? And so I'm offer that up for the chat. What is one bold idea or shift? I'll drop it for folks. And we'd love you to answer this. And I want to ask each of you, and if you could say it in one word, right? If it's more than one word, a phrase, but what is it that you'd like to see? A bold idea in the next 5 years, what can we do? Something that's tangible impact that you would like to see. Sonia, we're starting with you. Oh, you're on mute, love, you're on mute.
Okay, cool. So I was going to start typing in, because I'm going to stick with the story about what I was talking about, because I think the affordability and the access to all good nutrients and foods, as we're all talking about, is not easy in many circumstances. Not everybody has access to food that's affordable, that tastes good, and that is within a dietary nourishment. So I'm very, very aware of that, being a nutrition scientist. And for that reason, during pregnancy, I would love to see that the federal government would subsidize, or others, omega-3 fatty acid supplementation, because women do not take the 2 servings of fatty fish They could be allergic. It could be hard to get access to. They might not like it, for a variety of reasons. But this idea of bringing the risk reduction of preterm birth down to single digits or non-existent is amazing. So that's what I would love, is access of a supplementation to the right level.
Thank you. Esmerette, one word.
Oh, I don't even know how to do this on one word. Okay, if I'm going to use one word, okay, technically, I would do local CSA.
Love it.
And then in everybody, okay, thank you. No, we launched a CSA program last summer, and we're continuing this year, where we're able to connect all our 4 ecosystem, where through a grant we were able to buy local produce from local urban farm. So we were able to, and we had 2 portions to the program. One, it was very low barrier to sign up for the CSA. A weekly bag was $20. The worth that was valued at $80, but it was really to make it serve as gateway for families that don't feel, that are intimidated to go to the farmer's market, or also introduce new local produce. At the same time, we had a weekly chef that would come in, make a recipe based on this CSA bag, and we'll do recipe cards. And for every bag that we were able to, that people subscribe to, we were also able to donate 5. And we work directly with families at Walt Whitman houses in here in New York, which is part of NYCHA. And then the chef would also come in every week to make meals based on this recipe that we packed and placed this in fridges. So that was like a whole ecosystem out of this one initiative that allowed so many different people to participate, and also served as a gateway. So sorry, that was not one word.
Thank you, Ronit.
I will just say thank you to extend the food as medicine timeline through baby's first year.
Yes, thank you. This is so powerful. Thank you all for this panel. Thank you for all of our lightning talk presenters. Thank you to the Tufts team. Thank you, Katie and Hallie, for everything. This has been incredible. Want to just take some time for us to reflect, right, before we tap out. If there are any questions, we'd love to be able to answer them. What I think would be the best way for us to do that and respect the time that we have so generously had with you all, is that we will pull through the chat for the questions that you have left for us. And when we send an email out, we're going to send some answers, okay, along with resources. So that's how we'll do that. And for the time being, what we would love is for you to drop any reflections, any learnings, anything that you think you could take away from this 90 minutes that we've been able to spend together, to bring into your community, to bring into your work, to maybe even learn more, go deeper with. That'll be so great. We will be able to share with you the video link, so you can watch the replay. And when you watch the replay, you can see the slide presentations there. It's great to just, again, be here with everyone. I'll share a little bit of what I'm seeing in the chat. Eliminate the impact of food deserts, right? Ensuring that prenatal through the first 1,000 days for birth through 3 years, to anyone who needs it. A crucial, healthy start for families. Food injustice exists in the United States, but also other parts of the world. Thank you for these reflections. Keep bringing them in. And I'd love to turn it over to Katie for some final reflections. And just thank you all again.
Thank you so much, Latham. Thank you to everybody who joined us for this Lunch and Learn. It's such a great way to have lunch. I feel nourished by all of you. So much wisdom, so much brilliance. To our panelists, to our fireside chat people, just tons of gratitude. And look, this is the future, right? I mean, like, if we can't figure this out, these are the small humans that become our future. And this is a powerful group of wisdom leaders who can get it done, and I have faith. So thank you all for everything you do. It's truly beautiful. Latham, thank you so much for your leadership. Friendship, just really value it. And Hallie, thank you so much for your help. Everyone, have a wonderful week. And as Latham said, we'll follow up really soon.